Okay, a doctor's job is to diagnose the problem. And if you were to prescribe a solution or quote some sort of monetary figure without understanding the true problem, then that would be what would be considered, professional malpractice. So price is something that is completely contextual, and it has to be anchored to the cost of a missed opportunity. Price doesn't make sense in isolation. It just doesn't. It's ambiguous. So you're not going to want to quote price until you fully understand the patient's problem, and the cost also. The patient needs to understand the cost of not fixing the problem. And then what you can do is you can link your fees to the cost of your patient actually not doing anything about the issue they're coming to you for. So if they're coming to you and they're struggling with their CPAP, what's the cost of not doing anything? Well, they're not wearing their CPAP. The cost of not doing anything is they're cutting years off of their life by not following the treatment protocol they were prescribed. What are they going to miss out on by taking years off their life, or not having the energy they need, or sleeping in a separate bedroom than their spouse or bed partner? You have to let the patient know what those costs are. Okay. Now, people are coming to you because they know that you know how to do something that they can't do on their own. Okay. Really, really critical. You can do something that they can't do on their own. So there is a value to what you're providing, a monetary value, in fact. So the economics are completely in your favor, and the cost of doing business with you is actually drastically lower than them going at it alone, wasting their time, or even not doing anything about the problem. So this is why you should not be discussing price with your patient until you've connected the cost of your services to the cost of them doing nothing about it.